And since coronavirus started, I've been writing a lot, but I decided finally to make a couple of recordings, hopefully to answer some simple questions that I myself was having, and I'm sure that others out there are as well. So, what I want to focus on first is the difference between isolation and quarantine. We may be familiar, we've heard these terms nonstop the past few weeks, a couple of months, depending where we are in the world. But let's explain them. Isolation basically separates sick people with a contagious disease, such as the coronavirus, COVID 19, from people who are not sick. This is real important. When someone comes down with the symptoms and is diagnosed and the test positive for the coronavirus, they must be isolated immediately. Ideally, they should be by themselves, but in a case now where we're dealing with a pandemic where there's enough room that each person could have their own room, they're going to be grouped together with other people that are also testing positive for the coronavirus until they hopefully get rid of the symptoms and ultimately recover. The point of this is to recover from the virus without spreading it to others. Basically, our takeaway in terms of isolation is what happens when a person is affected with any communicable disease, and now we're all focusing on COVID 19. We want to separate them from people that are healthy, and it helps prevent the spread of the disease. And that's what many countries and cities and states are doing right now. Self-isolation, which is basically someone that may have symptoms of the coronavirus or any other communicable disease, but because of the lack of facilities, hospitals, what we're speaking of today, they're unable to be hospitalized, and even in makeshift hospitals, which many countries are currently setting up. They basically should self-isolate if they're showing symptoms until they can be properly tested and the test results actually come back. In some countries, this is also referred to as self-quarantine, but they should really, self-quarantine could be with others. So we really want to say this is self-isolation. And again, there's a discrepancy. Some medical professionals in certain countries and certain health organizations and ministries around the world may suggest that self-quarantine would be enough. But in my humble opinion, and it's a non-professional opinion, I do believe that if we can self-isolate, however and whenever possible, it's better, especially when we're dealing with such a pandemic as COVID-19, as the coronavirus. Quarantine actually separates and restricts the movements of people that were exposed to contagious or communicable disease to see if they become sick. If you were on a flight with someone, or you came in contact with someone or in the vicinity of someone that may have tested positive for the coronavirus, you would be put into quarantine. It varies on country how long you should be in quarantine for. Generally, it's from 10 to 21 days. Here in Israel, it's 14 days. But it's to make sure that you don't come down with the symptoms. You're in quarantine. Sometimes it can be an entire household in quarantine or a couple of members of a family that put into quarantine, but to make sure that no one comes down, shows any symptoms of the disease. And ideally, you would want to be tested for the disease as well, although there are a shortage of tests today, so it's not always possible. Basically, people are put in quarantine when they're not currently sick, but they may have been exposed to a communicable disease, the coronavirus or any other disease. And needless to say, this can help prevent the spread of any disease. Self-quarantine, or often referred to as voluntary quarantine, is when someone isn't actually ordered to go into quarantine, but they themselves feel that they might have been in a place and should be self-quarantined. Again, there's a number of countries in the world that's been mandated by the local governments that people go into self-quarantine, not because they've been necessarily exposed or around it, but because of the pandemic and because of the rate in the country, we want to be sure that they don't come down with any symptoms. So they're forced to go into self-quarantine. Just as a reminder, as we're dealing now with the coronavirus, wash your hands. Good soap and water, at least 20 seconds. And if there's nothing else that will come of this pandemic that we're all facing in the world, is cleaner hands. And I want to encourage everyone to stay active, both mentally and physically, during a time of quarantine, whether it's self-quarantine or mandated quarantine. You want to exercise both mentally and physically. It can help reduce your overall mood and happiness. And if you're feeling well enough and you don't have any symptoms, try even walking up a few flights of stairs, or you can even make a dance party in your own room. Again, this is Stuart Katz. I hope you've learned something, and we'll come back with some tips tomorrow. Have a great day.